Now, may I request Dr. Rengaraj to speak on role of AI in glaucoma. This is a new topic. Please, sir, Rengaraj.
Thank you. So I'll be just highlighting some experience we have on artificial intelligence in glaucoma. And I want to, this is a disclaimer, I'm not an expert, but someone who is deeply interested in AI and its potential applications for the future generations and our patients. And I always feel, all these automated systems perform tasks which are needing kind of human intelligence. Somewhere our intelligence is so important because it mimics the cognitive functions associated with the human mind by learning and also solving the problem. I'm sure you've been hearing all these terms day in and day out, but basically, you're trying to do something like you teach the machine, it learns, and then it also deep learns, because that's the subset which happens internally, wherein you can always think that it's something like a glorified statistics, but the computers are so smart these days, the supercomputers, which can really deep learn a lot of things and give valuable information to us. So whenever we talk about machine learning, there is supervised and unsupervised. I know once you start Kolkata, search Kolkata, you get Rasagulla to everything, where it is not guided by the correct inputs. But if you guide with the correct inputs, and if you make the machine learn properly, if you put the right information, then you're going to get very valuable results. But if you're going to put garbage inside, I'm sure garbage is going to be outside. So why do we need? I'm sure you all know the problem of glaucoma, 112 million in the year 2040. And more than that, many of them are not aware. So we need to find ways where we can detect more people and start managing them at much early stage. And you saw all these investigations. I mean, there are so many equipments involved to clinch a diagnosis of glaucoma. So this is the problem with the screening. There is no single screening test. There is a mismatch between the population to ophthalmologist, and we are finding best ways to screen so that we can detect early. But still, opportunistic screening is the best. And there's a lot of problem in specialty training and all that. So how AI can help at this point of time? It can classify whether it is glaucoma or non-glaucoma. It can also identify the progresses, especially the quick progresses, quickly. And then it can also study some of the risk factors and, of course, quality of life. So if you take AI in glaucoma, as I talked, there may be several work happening, but it can interpret fundus photo. It can identify the progression in visual fields. It can interpret your OCT, because you have DICOM, you have electronic medical record, you have all the information like what Madam Sushmita was showing. If there it in your system, it can do a lot of interpretation for you and also do this very important structure and function correlations. So I'm not going to the detail, but it's basically the convolutional neural network framework which happens, and it can beautifully classify glaucoma. It is trained. The CNN model is so trained, it can detect between a cat and a dog. It's something like that. It can start differentiating between a normal and a glaucoma once you start training it. So there are several papers which are listed like this, and there are beautiful survey and review articles on artificial intelligence in glaucoma. But basically, many of these papers are with the optic nerve head, but now we have a lot of papers coming on visual fields and OCT interpretation. And all these papers show a very good accuracy of machine over human also. And this is a big list of papers, as you see here. But basically, we actually wanted to do a lot of work in the base hospital, but we also wanted to see how this really helps in our vision centers which are working in the rural areas. So we tried to see how we can incorporate this into our vision centers. So these vision centers are small primary eye care centers in a rural area which are run by ophthalmic technician and an optometrist, and they screen roughly 1 million outpatients a year. In 2023, we saw almost 1 million outpatients, and most of them had glaucoma screening. So what we use is the fundus on phone. There's no commercial interest. It's a Remedio camera with their offline AI, which can do DR, glaucoma and ARMD in one shot. So the optometrists take a beautiful image and they do this, and it also analyzes for glaucoma. And what it does basically, it can also look at your cup to disc ratio, and also it highlights the areas of concerns. No, it's got a heat map which goes into the RNFL defect and vessel changes and all those peripapillary changes which happens. And it takes a holistic approach like a human, not only on the disc, something around the disc, and then it comes to a conclusion, and it can be reported and it can be uploaded into your EMR for future telemedicine. So what we did was we compared AI with our Vision Center consult doctors. These are people who are our residents, the final year residents. And when comparing artificial intelligence to our residents who are trained in glaucoma, the specificity you see is 98.6, but the sensitivity is very low. And if you see AI versus glaucoma glaucoma specialist, these patients were brought to the base hospital. We had very good sensitivity and specificity. So when comparing to somebody doing a telemedicine, a junior doctor or a resident doing telemedicine, the AI did a very good job. And more importantly, the AI also helped the telemedicine doctor to learn better. Now, when the AI could detect something, the telemedicine doctor was carefully looking at it and saying, oh, I missed this defect, oh, I missed this changes, or the subtle notch which the AI was able to pick up. So there are a lot of limitations. I said if you put garbage in, you will get garbage out. Now we are concerned about whether it is going to de-skill us. No, we are going to be worried about artificial intelligence in the futures. But definitely, no, I think we are in a kind of crossroads. But we really believe that it's going to enhance physicians and provide a better care. At this point of time, no, if you put all these data properly inside, you will get to detect glaucoma and to identify progress. But the future is so bright. No, if you have very good electronic medical record and if you collect the correct information in the form of clinical data, genomic data, lifestyle changes, knowing the risk factors, and of course the medical history, we can definitely say the risk analysis, we can find the best management protocols, we can predict the surgical success rate, and also find the accurate prognosis for the patient. Thank you.
Thank you very much, Dr. Venkatesh. I'm sure we'll have more of AI in our lives as we go along.